Question 1. A 68-year-old male arrives at the emergency department reporting sudden onset of right-sided weakness and slurred speech that began 30 minutes ago. He is alert but unable to move his right arm. Vital signs: BP 178/96 mmHg, HR 88 bpm, RR 18 per minute, SpO2 96% on room air. At the same time, a 45-year-old female presents with severe abdominal pain rated 9 out of 10 radiating to the back, vomiting, and a history of gallstones. Who should the nurse assess first? Answer: the 68-year-old male with stroke symptoms. Rationale: acute stroke symptoms within the treatment window are time-critical, possible thrombolytic therapy. Neurological deficits indicate impaired cerebral perfusion, making this the highest priority over severe pain without immediate life threat. Question 2. A 24-year-old male presents with shortness of breath after a basketball game. He has audible wheezing and is using accessory muscles. SpO2 is 88% on room air. Another patient, a 60-year-old female, reports chest discomfort described as burning after eating spicy food, with stable vital signs. Who should be seen first? Answer: the 24-year-old male with shortness of breath. Rationale: airway and breathing take priority. Hypoxia, SpO2 88%, and respiratory distress indicate impending respiratory failure, requiring immediate intervention over non-cardiac chest discomfort. Question 3. A 72-year-old patient arrives confused, with a blood glucose of 42 mg per deciliter. Another patient, a 30-year-old with a fractured wrist, is crying in pain rated 10 out of 10 but has stable vital signs. Who should the nurse assess first? Answer: the 72-year-old patient with hypoglycemia. Rationale: severe hypoglycemia can rapidly lead to seizures, coma, or death. Altered mental status indicates immediate neurologic compromise, making this priority over pain. Question 4. A 50-year-old male presents with chest pain radiating to the left arm, diaphoresis, and nausea. Another patient, a 40-year-old female, has a fever of 39 degrees Celsius 102.2 degrees Fahrenheit and productive cough. Who should be assessed first? Answer: the 50-year-old male with chest pain. Rationale: classic signs of myocardial infarction require immediate evaluation to prevent cardiac muscle damage and death. Fever and cough suggest infection but are less immediately life-threatening. Question 5. A 35-year-old female presents with anaphylaxis after eating peanuts, swelling of lips, stridor, and difficulty breathing. Another patient, a 60-year-old male, reports dizziness when standing with BP 100/60 mmHg. Who should be seen first? Answer: the 35-year-old female with anaphylaxis. Rationale: airway obstruction from anaphylaxis is life-threatening and requires immediate intervention, e.g., epinephrine. Orthostatic hypotension is less urgent. Question 6. A 28-year-old male presents with a stab wound to the abdomen. He is pale, diaphoretic, BP 84/50 mmHg. Another patient, a 50-year-old female, has a migraine headache with photophobia. Who should be assessed first? Answer: the 28-year-old male with hypotension and stab wound. Rationale: signs of shock and internal bleeding, hypotension, pallor, indicate life-threatening circulation compromise requiring immediate intervention. Question 7. A 65-year-old female presents with sudden vision loss in one eye and a severe headache. Another patient, a 22-year-old male, has a sprained ankle with swelling. Who should be seen first? Answer: the 65-year-old female with vision loss. Rationale: sudden vision loss may indicate stroke or retinal artery occlusion, both emergencies requiring rapid treatment to prevent permanent damage. Question 8. A 40-year-old male presents with confusion, fever, stiff neck, and photophobia. Another patient, a 55-year-old female, reports chronic back pain worsened today. Who should be assessed first? Answer: the 40-year-old male with suspected meningitis. Rationale: signs of meningitis, fever, neck stiffness, altered mental status, indicate a life-threatening infection requiring urgent treatment. Question 9. A 70-year-old male presents with new-onset atrial fibrillation with rapid ventricular response, HR 150 BPM, feeling dizzy. Another patient, a 33-year-old female, reports urinary burning and frequency. Who should be assessed first? Answer: the 70-year-old male with atrial fibrillation. Rationale: uncontrolled arrhythmias can compromise cardiac output and lead to instability. This is a higher priority than a urinary tract infection. Question 10. A 19-year-old female presents with suicidal thoughts but no plan and is calm. Another patient, a 60-year-old male, has severe respiratory distress, RR 32 per minute, unable to speak full sentences. Who should be seen first? Answer: the 60-year-old male with respiratory distress. Rationale: airway and breathing take immediate priority. Severe respiratory distress indicates imminent failure, requiring urgent intervention before addressing mental health concerns. Question 11. A 58-year-old male presents with sudden onset tearing chest pain radiating to the back. Blood pressure is 190/110 mmHg in the right arm and 150/90 mmHg in the left arm. Another patient, a 46-year-old female, reports nausea and vomiting for 2 days with mild dehydration. Who should the nurse assess first? Answer: the 58-year-old male with tearing chest pain. Rationale: findings suggest aortic dissection, a life-threatening emergency requiring immediate intervention due to risk of rupture and death. Question 12. A 30-year-old male presents with a history of asthma and now has silent chest on auscultation, SpO2 85%, and is drowsy. Another patient, a 25-year-old female, has a laceration on her hand requiring sutures. Who should be seen first? Answer: the 30-year-old male with silent chest. Rationale: a silent chest indicates minimal airflow and impending respiratory arrest. This is a critical airway emergency. Question 13. A 66-year-old female presents with unilateral leg swelling, warmth, and pain after a long flight. Another patient, a 72-year-old male, reports sudden shortness of breath and chest pain with SpO2 89%. Who should be assessed first? Answer: the 72-year-old male with shortness of breath. Rationale: this suggests pulmonary embolism, which is immediately life-threatening, whereas DVT without respiratory compromise is less urgent. Question 14. A 50-year-old male presents with black tarry stools and weakness. BP is 90/60 mmHg, HR 112 BPM. Another patient, a 34-year-old female, reports severe menstrual cramps. Who should be seen first? Answer: the 50-year-old male with GI bleeding. Rationale: signs of hypovolemia and GI bleeding indicate shock risk, requiring immediate intervention. Question 15. A 45-year-old female presents with confusion, fruity breath odor, and Kussmaul respirations. Blood glucose is 520 mg per deciliter. Another patient, a 60-year-old male, has mild hypertension and headache. Who should be assessed first? Answer: the 45-year-old female with DKA symptoms. Rationale: diabetic ketoacidosis involves metabolic acidosis and can progress rapidly to coma or death if untreated. Question 16. A 70-year-old male presents with inability to urinate for 12 hours and severe lower abdominal pain. Another patient, a 55-year-old female, presents with sudden onset facial droop and slurred speech. Who should be seen first? Answer: The 55-year-old female with stroke symptoms. Rationale. Stroke symptoms indicate acute neurological compromise requiring immediate evaluation within the treatment window. Question 17. A 29-year-old male presents after a motor vehicle accident, complaining of neck pain but is alert and stable. Another patient, a 62-year-old female, presents with severe bradycardia, HR 38 BPM, dizziness, and hypotension. Who should be assessed first? Answer. The 62-year-old female with bradycardia. Rationale. Symptomatic bradycardia can lead to decreased cardiac output and requires urgent intervention. Question 18. A 40-year-old male presents with high fever, hypotension, BP 86/50 mmHg, tachycardia, and suspected infection. Another patient, a 28-year-old female, reports mild allergic rash without breathing issues. Who should be seen first? Answer. The 40-year-old male with suspected sepsis. Rationale. Signs of septic shock require immediate treatment to prevent organ failure and death. Question 19. A 33-year-old female presents with ectopic pregnancy suspicion, severe abdominal pain, and dizziness. BP is 88/54 mmHg. Another patient, a 50-year-old male, reports chronic knee pain. Who should be assessed first? Answer. The 33-year-old female with suspected ectopic pregnancy. Rationale. Hypotension and severe pain suggest rupture and internal bleeding. This is life-threatening. Question 20. A 65-year-old male presents with acute confusion, unilateral weakness, and difficulty speaking that started 1 hour ago. Another patient, a 44-year-old female, reports a severe migraine with aura. Who should be seen first? Answer. The 65-year-old male with stroke symptoms. Rationale. Acute stroke symptoms within a short time frame require rapid intervention to preserve brain function. Question 21. A 52-year-old male presents with severe headache described as, the worst headache of my life, vomiting, and neck stiffness. BP is 170/100 mmHg. Another patient, a 37-year-old female, reports mild dizziness after standing up quickly. Who should the nurse assess first? Answer. The 52-year-old male with severe headache. Rationale. Findings suggest possible subarachnoid hemorrhage, a neurological emergency with risk of rapid deterioration and death. Question 22. A 23-year-old male presents with fever, sore throat, and difficulty swallowing but can speak in full sentences. Another patient, a 5-year-old child presents with drooling, sitting upright, and inspiratory stridor. Who should be assessed first? Answer. The 5-year-old child with drooling and stridor. Rationale. These are classic signs of epiglottitis, a life-threatening airway obstruction requiring immediate intervention. Question 23. A 60-year-old male presents with confusion, sodium level of 118 milliequivalent/L, and seizures. Another patient, a 42-year-old female, reports fatigue and mild anemia. Who should be seen first? Answer. The 60-year-old male with hyponatremia and seizures. Rationale. Severe hyponatremia causing seizures is a neurological emergency requiring immediate correction. Question 24. A 45-year-old female presents with sudden onset unilateral facial droop but no other deficits. Another patient, a 68-year-old male presents with chest pain, hypotension, BP 82/50 mmHg, and diaphoresis. Who should be assessed first? Answer. The 68-year-old male with chest pain and hypotension. Rationale. Hypotension with chest pain suggests cardiogenic shock or massive MI, which is immediately life-threatening. Question 25. A 34-year-old male presents with severe burns covering the chest and arms, with singed nasal hairs and hoarseness. Another patient, a 29-year-old female, reports a sprained ankle with swelling. Who should be seen first? Answer: the 34-year-old male with burns and hoarseness. Rationale: signs of inhalation injury indicate potential airway compromise, requiring immediate intervention. Question 26. A 72-year-old female presents with sudden inability to speak and right-sided paralysis that began 2 hours ago. Another patient, a 40-year-old male, presents with chronic back pain flare-up. Who should be assessed first? Answer: the 72-year-old female with stroke symptoms. Rationale: time-sensitive stroke management is critical to prevent permanent neurological damage. Question 27. A 55-year-old male presents with severe abdominal pain, rigid abdomen, and absent bowel sounds. Another patient, a 30-year-old female, reports nausea after eating. Who should be seen first? Answer: the 55-year-old male with rigid abdomen. Rationale: rigid abdomen suggests peritonitis, a surgical emergency requiring immediate evaluation. Question 28. A 48-year-old female presents with palpitations and HR 180 BPM, feeling lightheaded. Another patient, a 67-year-old male, has controlled hypertension and needs medication refill. Who should be assessed first? Answer: the 48-year-old female with tachycardia. Rationale: severe tachycardia can compromise cardiac output and lead to instability, requiring urgent management. Question 29. A 36-year-old female presents with severe allergic reaction, hives, wheezing, and hypotension, BP 78/40 mm of mercury. Another patient, a 50-year-old male, reports mild joint pain. Who should be seen first? Answer: the 36-year-old female with anaphylaxis. Rationale: anaphylactic shock involves airway compromise and circulatory collapse. Immediate treatment is required. Question 30. A 64-year-old male presents with sudden onset confusion, fever, and hypotension after a urinary infection. Another patient, a 25-year-old female, reports mild headache after stress. Who should be assessed first? Answer: the 64-year-old male with suspected septic shock. Rationale: septic shock leads to rapid organ failure and death if not treated immediately. Question 31. A 67-year-old male presents with sudden onset of left-sided weakness and inability to follow commands. Symptoms started 20 minutes ago. BP is 182/100 mmHg. Another patient, a 45-year-old female, presents with nausea and vomiting after food poisoning but is alert and stable. Who should the nurse assess first? Answer: the 67-year-old male with stroke symptoms. Rationale: acute stroke within the treatment window is a neurological emergency requiring immediate intervention to preserve brain function. Question 32. A 25-year-old male presents with chest trauma after a fall, tracheal deviation, absent breath sounds on one side, and severe respiratory distress. Another patient, a 50-year-old female, reports mild chest discomfort with normal ECG. Who should be seen first? Answer: the 25-year-old male with tracheal deviation. Rationale: findings indicate tension pneumothorax, a life-threatening condition requiring immediate decompression. Question 33. A 70-year-old female presents with sudden confusion, blood glucose of 35 mg per deciliter, and diaphoresis. Another patient, a 33-year-old male, presents with a fractured finger. Who should be assessed first? Answer: the 70-year-old female with hypoglycemia. Rationale: severe hypoglycemia can rapidly cause seizures, coma, or death and requires immediate correction. Question 34. A 60-year-old male presents with crushing chest pain, hypotension, and cool clammy skin. Another patient, a 42-year-old female, presents with fever and sore throat. Who should be seen first? Answer: the 60-year-old male with chest pain and hypotension. Rationale: signs indicate cardiogenic shock due to possible myocardial infarction, requiring immediate intervention. Question 35. A 38-year-old female presents with severe shortness of breath, inability to speak full sentences, and SpO2 86%. Another patient, a 55-year-old male, presents with chronic back pain exacerbation. Who should be assessed first? Answer: the 38-year-old female with respiratory distress. Rationale: airway and breathing compromise take highest priority due to risk of respiratory failure. Question 36. A 29-year-old male presents with severe abdominal pain and guarding after being hit during a football game. BP is 88/56 mmHg. Another patient, a 47-year-old female, reports mild indigestion. Who should be seen first? Answer: the 29-year-old male with hypotension and abdominal trauma. Rationale: signs suggest internal bleeding and shock, requiring immediate intervention. Question 37. A 62-year-old female presents with sudden loss of vision in both eyes and confusion. Another patient, a 35-year-old male, presents with a sprained wrist. Who should be assessed first? Answer: the 62-year-old female with vision loss and confusion. Rationale: these symptoms may indicate a neurological emergency such as stroke, requiring urgent evaluation. Question 38. A 50-year-old male presents with high fever, hypotension, tachycardia, and altered mental status following pneumonia. Another patient, a 28-year-old female, presents with mild rash and itching. Who should be seen first? Answer: the 50-year-old male with suspected septic shock. Rationale: septic shock is life-threatening and requires immediate aggressive treatment. Question 39. A 44-year-old female presents with severe headache, blurred vision, and BP 210/120 mmHg. Another patient, a 60-year-old male, presents with mild dizziness. Who should be assessed first? Answer: the 44-year-old female with hypertensive crisis. Rationale: hypertensive emergency can lead to stroke or organ damage and requires immediate treatment. Question 40. A 31-year-old pregnant female presents with vaginal bleeding, severe abdominal pain, and hypotension. Another patient, a 26-year-old female, presents with mild nausea in early pregnancy. Who should be seen first? Answer: the 31-year-old pregnant female with bleeding and hypotension. Rationale: findings suggest possible placental abruption or ruptured ectopic pregnancy, both life-threatening emergencies. Question 41. A 63-year-old male presents with sudden onset chest pain, shortness of breath, and unequal pulses in both arms. BP is 180/110 mmHg. Another patient, a 39-year-old female, reports mild fatigue after a long workday. Who should the nurse assess first? Answer: the 63-year-old male with chest pain and unequal pulses. Rationale: findings suggest aortic dissection, a life-threatening emergency with risk of rupture requiring immediate intervention. Question 42. A 27-year-old male presents with severe asthma attack, unable to speak, SpO2 84%, and minimal air movement. Another patient, a 55-year-old female, presents with controlled diabetes requesting medication refill. Who should be seen first? Answer: the 27-year-old male with severe asthma. Rationale: severe hypoxia and inability to speak indicate impending respiratory failure, requiring immediate airway management. Question 43. A 70-year-old female presents with confusion, fever, and stiff neck. Another patient, a 45-year-old male, reports chronic shoulder pain. Who should be assessed first? Answer: the 70-year-old female with suspected meningitis. Rationale: meningitis is a life-threatening infection requiring rapid treatment to prevent neurological damage and death. Question 44. A 58-year-old male presents with vomiting blood and BP 88/60 mm of mercury, HR 120 BPM. Another patient, a 30-year-old female, reports mild abdominal discomfort. Who should be seen first? Answer: the 58-year-old male with GI bleeding and hypotension. Rationale: hemodynamic instability indicates shock from blood loss, requiring immediate intervention. Question 45. A 49-year-old female presents with severe allergic reaction, throat swelling, stridor, and hypotension. Another patient, a 62-year-old male, reports mild dizziness when standing. Who should be assessed first? Answer: the 49-year-old female with anaphylaxis. Rationale: airway compromise and circulatory collapse in anaphylaxis are immediately life-threatening. Question 46. A 35-year-old male presents after a motorcycle crash with confusion, unequal pupils, and vomiting. Another patient, a 41-year-old female, reports a migraine headache. Who should be seen first? Answer: the 35-year-old male with head injury. Rationale: signs indicate increased intracranial pressure or brain injury, requiring immediate evaluation. Question 47. A 66-year-old male presents with severe bradycardia, HR 32 BPM, hypotension, and altered mental status. Another patient, a 28-year-old female, presents with urinary tract infection symptoms. Who should be assessed first? Answer: the 66-year-old male with bradycardia. Rationale: symptomatic bradycardia compromises cardiac output and can lead to cardiac arrest. Question 48. A 53-year-old female presents with sudden onset shortness of breath, chest pain, and SpO2 87%. Another patient, a 44-year-old male, reports mild back pain. Who should be seen first? Answer: the 53-year-old female with suspected pulmonary embolism. Rationale: hypoxia and chest pain indicate a life-threatening pulmonary embolism requiring urgent intervention. Question 49. A 61-year-old male presents with high fever, hypotension, tachycardia, and decreased urine output. Another patient, a 36-year-old female, reports mild allergic rash. Who should be assessed first? Answer: the 61-year-old male with septic shock. Rationale: septic shock leads to organ failure and death if not treated immediately. Question 50. A 72-year-old female presents with sudden inability to move her left side and slurred speech that began 45 minutes ago. Another patient, a 48-year-old male, reports chronic knee pain. Who should be seen first? Answer: the 72-year-old female with stroke symptoms. Rationale: acute stroke symptoms within the treatment window require immediate intervention to prevent permanent neurological damage. If you made it this far, you're not just practicing, you're training your clinical judgment at a high level. These who to see first questions aren't about memorization, they're about thinking like a nurse under pressure, where every second and every decision matters. Keep sharpening your prioritization skills, because in real life, the right decision can save a life. Stay consistent, stay focused, and I'll see you in the next one.